Welcome to IADH Now, your one-stop shop for all information regarding special care dentistry. I'm your host, Sharat Pani. The IADH podcast aims to bring you information, resources, and expert opinion on disorders, syndromes, and diseases that are often overlooked in training because they are too rare. Our disorder this week is FIbrodysplasia Ossificans Progressiva. Hadn't heard of the disorder? No problem, neither had I. One of the things we need to remember is that rare disorders are often overlooked in training because programs lack the expertise, the resources, or just the lack of the prevalence of that disorder in that area to provide training. FOP is an autosomal dominant gene disorder that is found in groups of families. And in this podcast, we're going to take you to trusted online sources about the disease, go through common signs and symptoms of the disease, discuss the dental management with two international experts, Dr. Clive Friedman from Canada and Dr. Gabriella Scagnet from Argentina. So if you're ready, let's start. Well, everybody knows the internet, but the internet is a vast ocean and it's easy to get lost. A good place to start with any rare disorder is often the National Institutes of Health or the NIH. The NIH has a genetics home reference, which is your guide to understanding genetic condition. It is an unbiased, non-partisan, non-funded source of resource that gives you the facts and just the facts. Again, full disclosure here, this is not a substitute for scientific literature or scientific papers. It is just a summary of the information regarding the disease. So if you look at Fibrodysplasia Ossificans Progressiva, it is a disorder in which muscle tissue and connective tissue such as tendons and ligaments are gradually replaced by bone-forming tissue. Outside the skeleton, that is extraskeletal or heterotrophic bone that constrains movement is formed. This process generally becomes noticeable in early childhood, starting with the neck and the shoulders and proceeding down the body into the limbs. Extraskeletal bone formation causes progressive loss of mobility as the joints become affected, and the inability to open the mouth may cause difficulty in speaking and eating. Over time, people with this disorder may experience malnutrition due to their eating problems. They may also have breathing difficulties as a result of extra bone formation around the rib cage that restricts expansion of the lungs. Any trauma to the muscles of an individual with FOP, such as a fall or invasive medical procedures, including dental procedures, may trigger episodes of muscle swelling and inflammation, called myositis, followed by more rapid ossification in the injured area. Flare-ups may also be caused by viral illnesses such as influenza. People with FOP are generally born with big malformed toes. This abnormality of the big toes is a characteristic feature that helps to distinguish the disorder from other bone and muscle problems. Affected individuals may also have short thumbs and other skeletal abnormalities. The disease is a very rare disorder that occurs in 1 in 2 million people. Now, put this in perspective. You may never see a patient with FOP in your life, even if you spent your entire life looking at special needs patients. So with that in mind, we take you now to our first international expert, Dr. Clive Friedman from Canada.
Why I would like to see individuals signing on to a group of folk who have information and knowledge with respect to treating this disorder is because as an organization, it's very difficult to get individuals to work with people who have a disease such as this with complications that are implicated orally. That's a good question. So this disease has been worked with, and a number of individuals, particularly in Philadelphia, and a group run by Dr. Fred Kaplan, who was and his group actually found the gene for FOP, have been working with this worldwide, and they are essentially the quintessential experts globally. There was a pediatric dentist who used to work with FOP from Philadelphia by the name of Dr. Burton Nussbaum. And Burton would work with many of these individuals and travel with Dr. Kaplan all over the world doing evaluations for these kids wherever they did evaluations and treatments. And he had a number of patients that were in Ontario, and he asked me if I'd be willing to treat them. And I said, sure. One of my patients' mothers, who's a very intense advocate in London, organized to have a conference in London, in my hometown, on FOP, where all the individuals from Canada with FOP came. So what they actually have is they have, on a yearly basis, they have a family gathering in different areas of the world where families with FOP all come to that gathering, and it's a family scientific gathering where all the scientists involved in FOP give an update on what's going on. And so that's, for example, what we did in Argentina with Gabriella. That was a family gathering, and they had, I think it was about 30 or 40 individuals with FOP from all over South America who gathered. And they have a day conference where they will give all of the current scientific evidence related to FOP, and it's given to the professionals and to the families, so that the families are very well aware of the current scientific evidence related to FOP. And so they did this in London, and they asked me if I would speak about FOP. And my emphasis has always been on prevention and risk management, because my belief is that I don't want, in any kid actually, I would prefer not having to do any kind of treatment, and everything we can do to manage and to minimize any kind of dental intervention is what my focus has always been. And the physicians, Dr. Kaplan and the other people who are with him, really liked that, I think, and so have subsequently asked me to give that talk at every single one of the family gatherings that they have. As in special needs, as you know, a lot of work that we do is not covered. So we don't get paid to do any of that. And so a lot of this traveling that I do comes out of my own pocket. And so it just becomes a little untenable to go to these family gatherings 3, 4, 5 times a year all over the world on your own dime. Have now created a